So we're continuing our discussion on the axial skeleton, and we'll talk about the spine today. All right, we're going to use some of our directional anatomical terms to help us describe how the spine develops, at least in terms of its curvature. So first off, I drew the profile of this person. So anatomically speaking, directionally speaking, what would be, I'll use my lightsaber here, what would be on this side? What would you call this? Okay, anterior, or what else could you call it? Ventral. All right, and then looking at the specimen here from this side is posterior or dorsal. Okay, so at birth, your spine has this shape to it, okay? And so we call this curvature, which is going from the posterior end, this would be convex, okay? And from the anterior end, this would be concave. Okay, so that's just really, is it coming out at you or is it depressed away from you? And we will call this curvature then the primary curvature. So there's no bends to the spine, it just comes out in a C shape. But after, a few weeks, let's say 4 weeks, maybe as early as 2 weeks, there's some variation there. Oh wait, let's also put in our different types of vertebrae. So we have our cervical vertebrae here in the neck, thoracic, lumbar, and sacral. We'll ignore the coccyx at this point. So after about a month, muscles and ligaments in the neck and the cervical vertebrae will develop to allow the infant to hold its head up and to move its head around. Okay, and that causes secondary curvature. And I'm exaggerating this. Okay. And so now we have secondary curvature. In our cervical vertebrae, all right, and I want you to take a minute and describe this secondary curvature using the terms we talked about before to your neighbor. So from the posterior end, the secondary curvature is now concave, right? And then the rest is convex. And it would be the opposite if you described it from the anterior end, which you very well could have, right? So it's now convex from the anterior end. All right, another developmental milestone occurs at about 11 months later. So this infant is now a toddler. What occurs at about 1 year old developmentally? Yeah, so the toddler is now able to walk. And so that primary curvature is still there in the neck, secondary curvature in the thoracic, and then we're going to exaggerate again, secondary curvature in the lumbar, primary curvature in the sacral. This is a good looking spine. All right, so now pick a side. Have your neighbor pick the other side, anterior, posterior, and describe the curvature of the spine at a year. Okay? What if you're going out the other side? Right. And so concave means, yeah, it's a depression as you're looking at it. But on the other side, it would be convex, right?
He was just looking at the answer.
Right. Exactly. Okay. Why does this occur? Why don't we just have a straight spine? Science, good.
If you do like any sort of jumping, you're not compressing your spine.
Okay, yeah, if you were straight up and down, compression could occur all along that, and you would have a lot at the bottom. So by having those little curves in there, you're able to adjust. We aren't going to get into the physics of it, but it would be able to space out that pressure at different points from your head, from your hips, from the bottom of your body, so on and so forth. And it's better for your back that way. Yeah.
Why do people do scoliosis if like slight? I guess so. Slight curvature is good, but if you have like scoliosis, which is like a lot of curvature, that's not helpful.
Well, we'll actually go over that in a second. So good question. So she's asking about scoliosis, which we're going to talk about right now, actually. So let's skip over, and we'll talk about spinal abnormalities. Okay. All right, so we're going to start with our guy again. And in, let's do kyphosis first. In kyphosis, your cervical vertebrae has a normal secondary curvature. But your thoracic vertebrae, we're exaggerating this, is more than it should be. All right, is this primary or secondary curvature? Primary, right? This is the original curve. Okay, is it concave or convex?
Depends on the side.
Yes, good. Depends on what side you're looking at, right? So from the anterior view, it'd be concave, posterior, convex. All right, so you have an exaggerated bend. You know, a lot of things may cause this. Poor posture, some back-breaking work, something like that. Anything that affects your spine over years and years can cause this. And so you'll generally see this more in older people who have experienced a lifetime of spinal pressure. Yeah.
You're talking about
Or injuries. Yeah.
Like hunchback people, like hunchback of Notre Dame and stuff. Is this but like more severe?
Yes.
Yeah.
Yeah, the Hunchback of Notre Dame had kyphosis.
But Igor.
Should be the kyphotic person.
Igor definitely had.
Igor, sure. And probably also had scoliosis, yeah. All right, but we'll do lordosis next. Okay, we'll continue to use our profile. We've got normal secondary curvature in the cervical spine. All right, so actually let's normal cervical vertebra curvature, normal thoracic, and then all right, so describe lordosis to your neighbor. What section of the spine and in what direction is it abnormal? All right, so this is occurring in the lumbar region. And it's called sway back, so it basically makes your posterior, your derriere, stick out.
Instagram model, right?
Yeah, totally. What's the pose? Something like that. Your leg up. This is, yeah. You got it.
You gotta stick out your butt a little more.
I'll work on it. Thank you, though.
Yeah, this would be a secondary curvature, right?
Right, so this is secondary curvature. Good, yes. Okay, and then we're going to go to scoliosis. And we're going to look differently. So now this is the back of their head. Got two little ears. Okay, what would this look like normally? What would a normal spine look like? All right, yeah, so from this angle, it's going to look like this. Even though there is primary and secondary curvature, it's just going away from you and towards you. So along this plane, it's not changing. But in scoliosis, the spine is abnormally lateral. And it can occur usually in the thoracic and lumbar vertebrae, but I guess could possibly occur in the cervical vertebrae as well. And it may just be in one or the other. It doesn't have a strict definition where it occurs. It could occur anywhere along there. It could be at any degree. And this, of course, is often a genetic condition, so people are born with the propensity for it. If it's just a minor case of it, you can often just brace and increase the posture, make the posture better to correct for it. But if it's a more severe case, then you may need surgery. Okay, so what I have here, taking up space that is accompanied by blood vessels and nerves, and so it's also very painful. Surgeries on these will often remove the herniations. They can sometimes come back though. And a common surgery really is to just get them removed and then have a fusion of these bones so you don't have any discs at all. What's that?
That's Eden.
Eden?
Ian.
Ian has.
Who's that?
Yeah, and especially in the lower lumbar region where you experience most of your compression, most of your the brunt of the force on your spine, that's where these are most common. Okay.
Dr. Hurt,
Yes.
what causes a slip disc?
So usually an injury where it slips out of place. And so that's not on here, but essentially that disc would then be somewhere where it shouldn't be.
Okay, so would you just need surgery to get that back into place? Or?
Yeah, I mean, the process is generally, let's do physical therapy and exercises and try and see if we can work it back into place through strengthening those muscles. Surgery is generally kind of a last option if you have to go in there, because it's dangerous to operate
Okay, and then
in that area.
is a ruptured disc the same thing as a degenerated disc?
No, so degenerated means they're just getting smaller and have less cartilage there. A ruptured one would be like where this herniated disc burst, right? So it's leaking fluid and cartilage into the area around it. So also not good and very painful. Okay, so that's all we have for today. I did want to show you one